You're alive, but you may have trouble controlling your urine, and you may have trouble having sexual intercourse. Radical prostatectomy has traditionally been used alone when cancer is small. In the event of positive margins or locally advanced disease found in pathology, radiation therapy is also given. Surgery may also be offered when a cancer is not responding to radiation therapy. However, because radiation therapy causes tissue changes, prostatectomy after radiation has a higher risk of complications. Now, what about a TURP? I mean, this is a term that has been around for 40, 50 years. I graduated from medical school 34 years ago now, in 1970, 32 years ago. And at that time, this was the most common procedure. It was called a TURP, which means transurethral resection of the prostate. Transurethral resection of the prostate, or TURP. It is a surgical procedure performed when the tube from the bladder to the penis is passed through the penis, is blocking, the urethra. So when the tumor is blocking your ability to urinate, then the TURP is used. So the TURP is generally for benign disease, usually, and is not meant as a definitive treatment for prostate cancer. It's the most common treatment for benign prostatic hypertrophy or enlargement of the prostate when it becomes so large that it blocks off the urine flow from the kidneys, through the bladder. So the TURP is mainly for the benign form, but it can also be used for complications in the malignant form. Complications of surgery. The most common serious complications of surgery are loss of urinary control and impotence, as mentioned. The reported rates of both complications vary widely depending on how they are accessed, by whom, and how long after surgery, as well as the setting. Is it an academic hospital? Is it a community-based hospital? Is it an advanced hospital? Is it a rural hospital? Do they have the highest form of technology, so forth and so on? Although penile sensation and the ability to achieve orgasm usually remain intact, erection and ejaculation are often impaired. Medications such as Viagra and Cialis or Levitra may restore some degree of potency. So Viagra can help, actually, this problem. For most men with organ-confined disease, a more limited nerve-sparing technique may help reduce urinary incontinence and impotence. What about radiation therapy? This is also called brachytherapy for prostatic cancer. It's used using seeds, small radioactive rods implanted directly into the tumor. So this is like microradiation. It's often used to treat all stages of prostate cancer or when surgery fails. Radiotherapy uses ionizing radiation to kill prostatic cancer cells. When absorbed in tissue, ionizing radiation such as gamma and X-rays damage the DNA in cells, which increases the probability of cell death. External beam radiation therapy is a linear accelerator. So there are different types of radiation. There's external beam, you see. This is delivered by a linear accelerator. Permanent implant radiotherapy is a popular treatment choice for patients with low to intermediate risk features. I mean, a lot of people I know this is the treatment they get, where they put the small seeds of radiation, they implant it in the prostate. And this is not invasive surgery. Radiation therapy is commonly used in prostatic cancer treatment. It may be used instead of surgery, and it's better if you can avoid the surgery, or after surgery in early stage prostate cancer. Radiation treatments can also be combined with hormonal therapy for intermediate risk, when radiation therapy alone is less likely to cure the cancer. Radiation therapy uses high energy rays or particles to kill cancer cells. When delivered in the correct dosage, radiation can reduce the risk of occurrence. Less common applications of radiotherapy are when cancer is compressing the spinal cord, or sometimes after surgery, such as when cancer is found in the seminal vesicles in the lymph nodes outside the prostatic capsule of the prostate or at the margins of the biopsy. Radiation therapy is often offered to men whose medical problems make surgery risky. Like, for instance, they have pre-existing heart disease, or they have, chronic obstructive pulmonary disease, such as this, or they may have kidney disease. They may be on dialysis, which means their immune system is very weak and cannot sustain the stress of aggressive surgery. So sometimes the surgery is contraindicated because the patient may have other diseases that cannot stand and tolerate surgery. So to do the surgery is really destructive. And in this case, radiation therapy is a treatment of choice. Side effects of radiation therapy may occur after a few weeks into treatment. Both types of radiation therapy may cause diarrhea and mild rectal bleeding due to radiation proctitis, which is the radiation influencing the rectum, damaging the rectum, as well as, of course, as we mentioned, urinary incontinence and impotence. Symptoms tend to improve over time. Rates for impotence when comparing radiation to nerve-sparing surgery are similar. So it's about the same side effect as surgery as far as sexual function is concerned. It's not any better. It's not any worse. Please bear with us. We're just about out of time. Cryosurgery. Cryosurgery is another method of treatment treating prostate cancer in which the prostate gland is exposed to freezing temperatures. It is less invasive than radical prostatectomy, and general anesthesia is less commonly used. Under ultrasound guidance, metal rods are inserted through the skin of the perineum into the prostate. Highly purified argon gas is used to cool the rods, freezing the surrounding tissue down to a minus 186 degrees centigrade, which is a minus 302 degrees Fahrenheit. That's extreme freeze, man. As the water within the prostate cells freeze, the cancer cells die. SubhanAllah. The urethra is protected from freezing by a catheter filled with warm liquid. So cryosurgery is also very effective and non-invasive. And last but not least, hormonal therapy. Hormonal therapy uses medications or surgery to block prostate cancer from getting higher levels of testosterone, a hormone produced in the prostate, and is required for the growth and spread of most prostate cancer cells. So the higher your level of testosterone, the higher the chance of prostate cancer. The lower your levels of testosterone or male hormone, the lower your chances of prostate cancer. Hormone therapy is therefore usually used when cancer has spread from the prostate. It may also be given to certain men undergoing radiation therapy or surgery to help prevent return of the cancer. Now, the last point I want to mention again. When it comes to prevention, the most common prevention, the best prevention, is not to stand and urinate. If you listen to this program and you're not a Muslim and you're standing and urinating, try to change that. Try to sit on the toilet when you urinate. Don't stand. Standing and urinating over a period of time puts stress on the prostate, and the highest rates of prostate cancer in the world are where men stand and urinate. It's very simple. Urination is something we have to do every day. You can't get around it. It's like eating and sleeping. It's a necessity of life. But how you do it, can help you or it can hurt you. Okay? You can write me at Medicine Islam, P.O. Box 111, Sharjah Television, Sharjah, UAE. Or you may send me a fax at 9716-5311-969. Or as most people choose to do, you may send me an email at medmanuae@eam.ae. And as our custom of Medicine in Islam, we conclude all our programs with a short dua, a short prayer of the Prophet Muhammad, peace be upon him, such that if any errors or mistakes have been made on this program, and most importantly, if any sins have been committed on this program, that Allah subhanahu wa ta'ala in His infinite mercy and grace will forgive us. Subhanallahi wa bihamdihi, subhanakallahu wa bihamdika, ونشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. جزاكم الله خيرا. May Allah reward you with the very best Islam.